Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to talk a little bit about plantar fasciitis or heel pain, which as a practicing chiropractor, this is something I see quite frequently and have over the years, and generally can be very well managed and rarely needs anything like cortisone injections or, God forbid, surgery to help manage it. But unfortunately, most people don't usually get the right treatment and the right information for how to manage plantar fasciitis or heel pain. This particular study just reinforces what I've seen in my office over the years, is that you have to treat most of the lower extremity of the leg. So let's say you've got right heel pain, you have to treat muscles of the hamstring, of the gastrocs, the calf muscles, as well as some of the fascia and smaller muscles of the foot to really effectively treat plantar fasciitis. So this particular study reinforces that idea that these trigger points are present in the muscles in the back of the leg and really need to be treated by somebody who understands how to treat soft tissue to really get over plantar fasciitis and to fully treat it. Beyond that, so when somebody comes into my office, we're going to work on the muscles of the back, we're going to do stretching of the legs, the hamstring, we're going to use soft tissue techniques like Graston, on the plantar fascia itself to loosen up any scar tissue or adhesions. For home, this is where things become even more important. First of all, as much as we may love high heels, they're not good for heel pain. Anything that keeps the toes pointed are going to keep the tighter the calf muscles are, the more problems we're going to have, because essentially the calf muscles and the bottom of the foot are all one long piece. So anything we can do to keep things stretched, the better off we're going to be. That means not wearing high heels. That goes for you guys as well, who may sport them on the weekends. And it also means that most of our lives were spent with our toes pointed down. So we want them stretched out up. We don't want them pointed down, which is going to tighten up that muscle. That means sitting at the computer. That means sleeping. That means driving. Almost everything you do during the day has your toes pointed. And when we're talking about stretching those out, we're not talking about 30 seconds. We're talking about spending a good chunk of your day with your toes pointed up. So I used to tell patients to just put a phone book underneath your desk, and then they would rest their toes on the phone book so that your toes are up like this. Well, you can't get a phone book anymore, but a 4x4 block or even maybe a 2x2 block or 2x4 block may be enough to keep that foot up. You can also look at things like night splints. So what do night splints do? They keep your foot, it's almost like a sock that keeps your toes pointed up all night long, so that when you don't first get out of bed, everything's been tightened up and those first couple steps are disastrously painful. So that's where the night splints come in handy. Rarely have to use them in the practice, but if we need to, that becomes kind of the final straw that anybody would need to really get over this. Orthotics, so custom fit orthotics to help support the arch is another important component of managing these for the long run. Personally, I have orthotics in just about every pair of shoes that I wear, and I've dealt with heel pain in the past, and I've managed it quite effectively with everything that we've just talked about here. And orthotics became a part of the long-term management of that. So there's any time that I'm on my feet for a long period of time, I've got the support of the arches, so I don't have to worry about stressing the heel pain. So as always, I will post a link to this particular study looking at the trigger points in the back of the leg and heel pain in the comment section, and make sure you like this video, share it with somebody who you know limps for that first 10 steps when they get out of bed, and subscribe to the channel.